Well, welcome to the Eyecare Experts. I'm Dr. Bell, Dr. Terrezza, and we have Dr. Ballard with us. Certainly, we're glad to have him. You've been here before, but it's been a little bit, so you'd have to go back through the list of earlier podcasts, 10 or 12 months ago to see. But we're glad to have you with us today. And we're going to get into some stuff, but I want everybody to know we have a pretty good topic to talk about. We talk about day to day. I get the question is, do you get tired? Is it monotonous? Do you do the same thing every time? And in this case, the title of this podcast is Neuro-Optometry and Genetic Eye Health. In some of these cases, it's trial and error trying to figure out what the cause is. It's not maybe as simple as, hey, I know what's going on that day. This is what you need. Some of these you have to dive into, and that's what makes them interesting. And certainly we want to get into that. A lot of things, this applies to a lot of people. And sometimes you know what's going on, sometimes you don't. So we got a lot to talk about with neuro-optometry. But I wanted Dr. Ballard to kind of give us a little bit, since it's been a while. Tell us about where you grew up, where you went to school and all that stuff.
So, I've been with the group here going on my 7th year, which seems, kind of crazy to me. But
time flies.
I was the new guy for a while, But I grew up here in Pensacola, Florida, went to college at University of Florida here, in Gainesville, and then up to UAB up in Birmingham, where Dr. T is also an esteemed member of that graduating school here. Yes. Yep. And then returned back here and joined the practice in 2020. And currently I practice both at our new Baptist location, which is 121 Baptist Way at the Henderson Health Building, which is a fairly new building. We have new equipment, plenty of parking, good accessibility for all types of people. And then also I work 1 day a week over at Bellard and Terrezza on Fairfield and Lillian. And I've been over there since I started. So, I have to keep seeing the people.
We appreciate it. I know there's a lot of patients that certainly want to see you over there at the Fairfield office.
Enjoy seeing them. It's kind of like, going home a little bit, because that's where my first week on the job was over there, and that's where I've interviewed. And so it's nice to see all the familiar faces back too.
Well, going back to the other location he mentioned as far as Baptist right there, everybody knows the new Baptist Hospital right there by, 110. You've got two buildings, the Bears Foundation, I think, on one side, and then the Henderson Building on the other. And we're located on that first floor in the Henderson Building, right beside the Starbucks. And we're kind of split. It's kind of a unique setup where you have kind of the retail optical on one corner, and then we have the medical exams on the other.
Correct. And if you go in either one, they will direct you to the right place to be. There's also a virtual directory. There's usually people around in the lobby. That building's kind of cool because it's, Baptist has been trying to be a kind of one-stop healthcare spot. So we have over there's dermatology, there's physical therapy, there's an oral surgeon, and they're actually still expanding on it. So, if you're looking for somewhere where you can kind of get everything done in one place, it's actually coming together like that.
Well, I know every time I drive by, it seems like it's the parking lots. There's more people in the parking lot every month, every year. It's grown so since it opened.
It's a whole lot going on over there.
So if you want to see Dr. Ballard, certainly Fairfield Baptist, he'd love to see you. He does a lot of things, and I think one of the things certainly he does very well and very interested in is specialty contact lenses, scleral fits, any of those contacts where, hey, you're not seeing as well, you're having trouble, maybe you've tried contact lenses in the past and it didn't work out.
Right.
Certainly give him a call.
Or if you'd like a second opinion, if you've tried from multiple eye doctors, multiple places, I'm not going to guarantee I can fix it, but I will say I enjoy that challenge, and if there is a way to get you comfortable and seeing well in contacts, I'm willing to take the time to do that. But another one I'm fairly interested in is our topic today.
Yeah, let's dive into it. Speaking of that, so back to it, neuro-optometry and genetic eye health, especially with May coming, as far as the month of May, Inherited Retinal Disease Genetic Testing Month, along with American Stroke Month, a lot going on, and certainly we want to kind of dive into that. And I guess let's just kind of take it wherever you want to take it as far as how does neuro-optometry affect you, relate to you. It may not every day, you may not see a patient, but in general, maybe some tough patients or just anything you want to kind of talk about.
Well, I've been referring at least one or two patients a week in the last few years, as my clientele has gotten older, I've been here a long time, and I'm referring them to neurology for various eye conditions that have a systemic base. And we're very happy with our referrals to Dr. Kohler, for instance, a neurosurgeon, Dr. Ballard, Dr. Bear's Clinic at Woodland.
Faruqi.
Dr. Faruqi, that's correct. And in Milton, we use Dr. Sultan, and he takes a lot of the insurances that are very difficult to find people to take. And it's very hard to find a specialist in many areas, but neurology is probably the top of the line. Mm-hmm. So we enjoy working with them, and those patients are always challenging at best.
Yeah, and as far as how we interact with patients with neuro-optometry, I feel like they almost fit in 2 or 3 different categories. You have some that end up, I woke up this morning, I have double vision, what's going on? Am I having a stroke? Is something terrible happening, or is it something more just visually disturbing? And those are very important, and we can't tell you over the phone. You have to, come in either to us or the ER or somebody, if you have an acute or a sudden double vision, right? So a lot of times if you're calling and you're having that plus other symptoms or, other neurological problems, we may say, don't pass go, do not collect $200, go straight to the emergency room. But if it's something more where, I've had this for a little bit, it seems to be getting worse, double sometimes, or just when I look up, or just when I look down, that's something where neuro-optometry, fixing your vision with prisms or with, other methods can sometimes, be a game changer for your visual function and your, how comfortable you are.
Yeah, I mean, to expand on that, for me, I guess day to day, to me, it's almost like some patients have a subtle, maybe like something that they've complained about or noticed, but really didn't understand what was going on, and they've dealt with it, but it seems to be getting worse. And then once you talk to them, you say, when did this start? And then you kind of start figuring out where this is leading to. And then on the flip side of that, you have patients who come in, and this is something that just happened yesterday, and hey, I'm seeing double doc, I'm seeing 2 images. Or, hey, my eye is blurry, I can't see anything, or it went black, yesterday. So these are conditions that it could be subtle, or it could be very in your face. And we certainly want you to give us a call, because in some of these cases we're going to get into, these could be sight threatening, it could take away your vision. Some of these cases can be very, very serious.
Can be life threatening.
Can be life threatening, and sometimes we won't know until we get into it, see the nerve, see the back of the eye, see the blood flow, making sure oxygen, do you have any, obstructions? There's a lot of things we're looking at.
How are the pupils? Yep. There's a lot that goes into making an accurate decision on these, and I'll tell you what's always the wrong decision is waiting. If it's something that is new and bothersome and something enough to wake you up in the morning or wake you up at night, then it's definitely worth an evaluation.
Those very subtle symptoms, those are the ones you have to catch, and you need specialized equipment to do that. You can't just wing it. Mm-hmm. And I'm proud to say that things like angiography, like B scans, like in-depth photos of the eye, a test which measures the tomography, which measures the thickness and shape of the 10 layers at the back of the eye. We have all that. And we're able to diagnose based on that on a scale in the nanometer thing, which is 1,000th of a millimeter, magnitude, that these things can show up in very subtly. And of course, we send a neurologist or the appropriate pain management clinics for things that we think are wrong based on that.
Yeah, I mean, that's at each of our offices, we have there's some equipment that's not at every offices, but we have OCTs at each office. We have visual fields. Like you mentioned, we have B scans, we have ERGs, we have maculogic. We have all those things to help us to figure out, what your issue is. When you come in with eye pain, you come in with double vision, you come in with pupil abnormality, one pupil's larger or smaller than the other, doesn't constrict or dilate. We want to dive into it and figure out what's going on.
Right.
And more often than not, we can come up with a diagnosis and tell the patient that day, hey, this is what we think or this is what we know is happening. In some cases, we have to narrow it down and say, hey, we think it's this or the other. But even if we can't give you a definitive diagnosis, we certainly can get you referred to some of the neurologists you had mentioned earlier, retinal specialists. We can get you to who you need to see. And that's one of the great things about our network is we know everybody. You've been here
Right.
forever, and we're going to get you in as quickly as we can to get this problem addressed.
And you're not wasting time going to maybe the wrong person. Say for a general neurologist or a general ophthalmologist, it may take you a month to get in, and if they go, oh well, I don't prescribe prisms, I don't do double vision, you're back at square one. And I can tell you right now, if you come in with a double vision problem, we will have an answer for you or a tentative plan that day. We're not going to ignore it because that's how we operate.
Yeah, and the signs can be as subtle as, Doc, I was blurry on Monday, Tuesday it cleared up, Thursday it got very blurred, and you just sort of blow it off. But in fact, that could be tied to several etiologies that are difficult to diagnose, including diabetes, including central nervous system disorders. And those have to be ruled out.
So things to look for: vision loss, unexplained vision loss, pupil abnormalities. Why is this pupil not constricting, or why is it a different size than the other? Double vision we've talked about. And it could be two images. It could be a ghost image. It could be vertically double, horizontally double, diagonally double. There's a lot of different things there. Did you have a stroke? Worst case, is there a tumor?
Fleeting vision loss,
Yep.
one eye graying out, or
Parts of the vision going out, like the central vision in one eye
Or the peripheral.
and the side vision in the other. Well, that can be a lot of things. You have to go through the whole flow chart and find that out.
But the take home is, if you're experiencing any of these issues, do not blow it off and say, hey, it's just going to get better, or hey, maybe it was because I was tired or fatigued. I would love to tell you everything is great, but we'd rather you come in.
Absolutely.
Let's look at it and make sure everything is good, because with eyes, and we've said this, I don't know how many times we've said this on prior podcasts, the earlier we diagnose and get something in, usually the better the outcome is going to be.
That's true.
So we want you to come in.
And I'll tell you, we threw out a bunch of potentially sight or life-threatening conditions, but now think of our other category where, say, maybe the patient did have a stroke and they've been to neurology and they're still just not seeing well, or they're not able to read, or they're covering an eye to read. A lot of times these more, like Dr. T said, these subtle sort of annoying visual things have a fix. I've had people come in and they've just been covering an eye to read.
Yeah.
And turns out they need a prism in their glasses, and now they can read.
Well, you're dead on. I've got a few questions. Let's go through some of these questions here, and you guys can kind of take it. Some of these are pretty general, so we talked about this a little bit, but what symptoms should I never ignore? What would be an emergency where, hey, if you're experiencing this, give us a call or come in as soon as you can? What would you?
The fact if vision in one eye went out suddenly,
Sudden loss of vision in one eye.
sudden loss,
Okay.
and it's not. And if you see any of the symptoms with that, like drooping of the face on the affected side, inability to move an arm, speaking problems, slurred vision, slurred speech, I should say. And that would be the big one.
Yeah, those are the big
that I
ones.
catch.
Yeah, I'd say the sudden painless vision loss, monocular, one eye. If one eye goes gray and then goes black, even if it comes back, something's wrong.
Yeah.
You need to figure out what.
And then we try to dive into it and see, is it acute, progressive, what the underlying etiology is that's leading
Could be
to
a
that.
black carotid. It could be, serious stuff.
Next question. What are some things, and we're talking about neuro here today, but what could cause eye pain with eye movement? What are some of the things? I would say optic neuritis, inflammation of the nerve.
Cellulitis.
Cellulitis, orbital, preceptal.
Entrapped muscle from a previous fracture.
I've had it with bad sinus conditions too.
Yeah. Sometimes thyroid eye disease will make it feel kind of tight, and that can cause double vision too.
Or thyroid that's out of line that was previously controlled and now is uncontrolled.
And I would say with that, that's another one we definitely want to see. If you're having eye pain for whatever you may have going on systemically, we want to diagnose the eye, not only the eye, but the whole orbital issues, because with thyroid and things like that, there's so many things that are going on with the sinus cavities, the muscles, the orbital.
A lot of stuff. So where your optic nerve goes back to your brain, it runs through a sinus area, and it has muscles around it. There's a lot of important stuff in that region. And so if you have pain behind the eye, and your eye's not infected on the front, something is going on, and you may not have the answer that day, but you can't ignore those because a lot of critical, anatomy goes through that
And those
spot.
symptoms can come and go, so
Yes,
you kind
they
of
can.
play with it and say, oh, I'm fine, but you're not fine.
Yep.
Well, we do fit contacts, we fit glasses, but these are some examples of other things that we do. And sometimes these are the ones of the more interesting cases that we deal with. And these are the patients that, sometimes they've had this going, and in the past, maybe nobody even brought it up. Maybe nobody, looked at it or they're dived into it. And we firmly believe we want to get you seeing the best. But to do that, we've got to treat the health conditions of the eye and how they relate systemically to the
You
body.
can't just be an eyeglass provider or a contact lens provider. That's almost a separate issue in and of itself. But trying to find, if you have those symptoms, or to get into a neurosurgeon or to get into a retina specialist quickly, good luck with that, because they're highly, they're very busy and they're highly booked in advance. So it's going to be, you go to primary care. That's the beauty of primary care. A primary care doc can look at you and sort out the problems and tell you if it's serious or it's something that's mimicking something serious, but it's not. And you have to get that decision first. It's called triage in medicine. And that's what emergency rooms do a lot of the times.
Well, very good information. It's been a great podcast. Thank you, Dr. Ballard. Again, if you want to see him, Fairfield and Baptist, and you're at all locations, and I'm at 9 Mile and Fairfield
Everywhere all
most
the
of the time.
And these are some of the rarer but more satisfying cases for us. Sure, they set me behind half an hour and the waiting room's full of people mad at me, but when you can fix these, you've either saved someone's vision, saved a life, or you have made a difficult vision situation tolerable. So when someone comes back and says, I could never wear any glasses for the last 2 years because I was seeing double, and now I can read my Bible or I can read a book comfortably for hours. I mean, it's a pretty cool feeling,
I think that I don't know what they're made of, but the neurosurgeons and the neuropathologists that deal with this every day, I just think that stress level would be harmful.
I need their...
I think it's a good mix with the
You want a
general
little
stuff.
sprinkled in.
Give me 1 in 20 is plenty.
Well, thank you all for watching. Stay tuned for future podcasts of the Eyecare Experts. Till next time, thank y'all.
See you.